Hi, Mary with Premier. I'm going to clear up a little bit of confusion with microdermabrasion. So microdermabrasion can be good at many different things. So it can smooth out fine lines and wrinkles. It can help to smooth out acne scars. It can also just be a buffer so you can do a light exfoliation. That way when anything that you put on the skin afterwards, it'll penetrate a lot better. So anytime that you do a resurfacing to the skin, exfoliation at home, a professional treatment, and you do resurfacing, then anything you put on the skin afterwards penetrates a lot better. So if you have uneven pigmentation, the whole goal is to use either the one with granules or the diamond tip. I have been back and forth over 20 years. I have tried both. 10 years I did the loose crystals, and it blows crystals onto your skin, aluminum oxide crystals, and then suctions the dead skin and the crystals back off the skin, and that's how it resurfaces. The diamond tip, which I got turned on to around 2010 and 11, I stuck with that for about 5 years, and it's just all the crystals are stationary on the tip, and basically it's just a little bit rough, and it's just sand in the face without all that blowing the individual crystals on the skin, and then not all the irritation of the suctioning off. So you can incorporate it with so many other things. The vitamin C enzyme, the signature facelift, the Ormedic, if you have congestion and a lot of blackheads, and that you want to get your pores, like a deep pore cleansing, and you want to add microdermabrasion. Only adding microdermabrasion to anti-aging or congested skin or uneven pigmentation when you don't have active pustules, if you have active breakouts and whiteheads. Other than that, if you have broken capillaries, cuperose skin, rosacea, you're not a good candidate for it. But there's other things that you can do to resurface the skin without having to do all that manual exfoliation for people who do have broken capillaries, and you don't need that suction. You need to be very, very careful with that, because there's so many people that are new to the industry and start using microderm, and they'll use it like around the nose where you have those little broken capillaries, or they'll use it too close to the eye and not turn it down. So you want to make sure any broken capillaries, any rosacea's not worked on, broken capillaries, and then too close to the eye, it needs to be turned down. I'm more in favor of the diamond tip than I am of the loose crystals. However, I've used both over the past 20 years. It's according to skin type and what it is that you need. But that's the difference between the diamond tip and the loose crystals. Basically, one blows the crystals on your face, resurfaces and suctions the dead skin cells back off with the crystals. The other one is the crystals are stationary on the tip, and it basically resurfaces manually and then suctions off the dead skin cells. You get less irritation with diamond tip, and that's why I choose to use diamond tip the majority of the time. But if you guys have any more questions on microderm, I'd be happy to answer them anytime.